All right. Hello, Ben. My name is Nicole. I'm one of the athletic trainers that your provider has for telemedicine. So today, I'm going to go ahead and just verify that you are who you are, and then we'll kind of go through kind of an evaluation, and I'll listen to your concerns and everything like that, and then we'll kind of set up a plan that we can do over the next couple weeks, and then we'll revisit that in the next couple weeks. Okay. So
Okay.
one thing I want to just do here, just to double check who you are and identify who you are, if you could just state your name and then what kind of, who told you to come here, and then what's really kind of going on with you.
Yeah. So my name is Ben Cleddy. I'm 21 years old. My coach was the one that told me I had to come here. I've been having some pretty bad pain in my lower back recently. So my coach told me that I needed to get it. I needed to report it to somebody so that I could have it looked at. Just because I really don't like not being able to like lift and participate in practice anymore. So that's really been kind of the thing that's been getting me. It's really just been kind of annoying. And I mean, I just kind of kept telling him I could push through it and I didn't really have to do this, but he kind of told me that it had to happen. Otherwise he would just shut me down completely. So,
Okay, awesome. And I appreciate you being honest with me and telling me what's been going on.
mhm.
Really quick, I also just want to give you my contact information so that
Okay.
if this call gets shut off or anything like that, you have a quick email to send it to me, or we'll obviously jump back on the recording. But at least you'll have my contact information moving forward as well. Okay. So
Okay.
what I can do here is even just in this chat, I'm just going to shoot it over to you so that you have it. Okay. I'll go ahead
Okay.
and
Thank you.
do that right now. And then I'll just have you verify when you do get it so that you can at least let me know that you have it.
Yeah, I see it.
Okay, awesome. So that will just be kind of our contact information in case something happens with the call, or obviously moving forward as well. Okay.
Okay.
So as you are talking, I am going to be kind of writing some notes. So if you kind of see me just jotting down some information, I just want to let you know that's what I'm doing. Okay.
Okay.
So, can you go ahead and talk about, let's talk about how long has the pain been there? I know Coach said that they wanted you to come in. What exactly, how long has the pain been there?
Um, this specific pain, it's been about a month that it's been like really, really bad.
Okay.
But I mean, I have had low back pain that really kind of started my senior year of high school. So that would have been 3 years ago now. Um, it wasn't as bad then. It kind of got progressively worse when I got into college and I started doing more. But it was never really anything I couldn't push through or ice up or anything like that. So now it's just kind of gotten to the point where, like I said, coach made me have to come in because it's affecting the amount like I can lift and how often I can get through practice.
Okay. And then kind of at rest, are you in any pain right now? And
Um,
so we'll kind of use a pain scale 0 to 10 at
okay.
rest, and then obviously at its worst, whether it's lifting, maybe we'll go pain when you're lifting, and then pain with just walking, things like that.
Oh man, the worst it's ever been. Honestly, felt like a 9 out of 10 a couple times. That was more with lifting and practice. Um, just sitting. I mean, every once in a while, like if I stand for a long time or if I sit for a long time, it bugs me quite a bit. So, but not really much higher than like a 2 or a 3. Walking, I don't really seem to have any constant pain. Um, it's really just like staying in the same position for a long time, and then anything with practicing or lifting, it always seems to come back.
Okay. And then what type of pain are you having? Is it shooting, stabbing, kind of aching all the time? And then one thing that I want to know is really if you're getting any numbness or tingling, is it going down your leg? Is it radiating up your back? Kind of if you could touch on that.
Yeah, it gets really, really painful, kind of like it almost feels like kind of dead center in the back. I guess you kind of call it sharp, but no, I've never really like had anything. I've never had any symptoms go down my legs or anything. Is that common for back injuries?
Not necessarily. I mean, if there was something maybe nerve impingement or disc related,
Oh,
then you might
okay.
get some kind of numbness or tingling down the leg. But because you're not complaining of that, I'm not worried about it. But sometimes with repetitive use, you can get that.
Hmm.
Um, so no numbs and tingling, and then again, kind of just going through some red flags that I would think of. Any issues with bowel movement, urination, anything like that, where you're like, oh, this really hurts my back, pushing, anything like that.
No,
Okay.
no, nothing like that.
Okay. Um, all right. And then I know when we were kind of talking, you kind of almost like reached behind you. Would you be like well enough to go ahead and stand and maybe just lift up your shirt and kind of show me where that pain is?
Oh yeah, I could do that. Hold on, let me just move this table over. So it's like the worst pain is in this spot right here.
Okay.
Sometimes it gets a little red, but I never really feel any like swelling or puffiness or anything like that. But I'd say honestly, like right there. Actually, I'm gonna stop doing that because that hurts a lot. But uh, that's probably the most painful spot, and it almost feels like I don't know. It's weird because when I like press there, it seems like it's not as like prominent as the ones around it. It almost seems like it's like pushed in at all, and it hurts a lot.
Okay. And you've noticed kind of this increased pain over the last couple years, but more so in the last maybe year or 2 years since you've been starting to lift more and push more and things like that.
Yeah, so I guess so like I redshirted my freshman year
Okay.
because they like I started lifting during my senior year of high school and but when I got to the team they kind of said that I still needed to focus on that before I was going to get any type of playing time. So I hit that like extremely hard now. Like I mean, it's basically lifting in practice all the time for me. And so that first freshman year, like I did a lot, and now it's just to the point where like it's unbearable.
Okay. And when you're lifting, do you guys have a strength conditioning coach or anything like that? Or are you kind of
Yeah.
just lifting on your own?
No, we do.
Okay. And has he kind of ever really looked at your form of squatting techniques and deadlifting techniques? And has anything that you can tell me that like, that, oh yeah, maybe I kind of tilt my pelvis forward or anything like that he's told you?
Um, he hasn't said anything specifically. He said that like with squatting, I look fine. He said that like deadlifting, a lot of it is a more like explosive motion for me. He notices that I get like really good power out of it. And so he just tells me that sometimes I have to be careful how far I arch back. But which I mean that does cause me pain when I go really far back. So it's just kind of this point now where like I was talking with him the other day because I wasn't able to improve my max over like the last, I don't know, 2 months. And I feel like now whenever I go in there, I can't do anything more than like 50, 60% of my max for a deadlift specifically.
Yeah, that's got to be probably pretty difficult, especially when you're around other people that might be maxing out. So, I guess kind of going off of that, let's go back to your medical history, things like that in the past. Anything that stands out that might help me, whether you've dealt with anxiety, depression, anything along those lines. I know it's kind of a sensitive subject, but you're also going through something really difficult, and so that's something that's really important to me that we kind of just talk about.
Yeah. No, none of that. I mean, like I mean, like football and lifting at this point is kind of like the majority of what I do. I mean, like all my friends are pretty much on the team. So like, I don't necessarily do too much outside of it, which I'm okay with. I don't really mind it. Like I want to be in there. I think that's kind of why this is, becoming such a big problem for me is I want to be doing more of that. But no, and nothing like that. I've never seen anybody for something like that.
Okay. And obviously, if that becomes a more underlining factor, then I definitely want you to reach out either back to me or back to your coach and things like that, because that is a normal response. And I want you to know that we care enough about you that if that's happening, that we need to know. Does that make
Okay.
sense?
Yeah, I
Okay.
appreciate that a lot, actually.
Yeah, of course. So really quick, I'm gonna kind of stand up and go through some quick motions. I want you to do them with me, okay? And then we're gonna go through. I know you said extension probably bothers you because that's
Yeah.
what I kind of keep talking about.
Yeah.
So right in here. So what I want you to do, keeping your hands on your waist, I want you to just try to flex on down, and let me know if you start having any pain.
Uh, Not a ton, but usually when like we start with a warm up where we kind of do that with trunk motion,
Okay.
and after like the fifth rep of it, it really starts to hurt.
Okay. And then here, what about going back into extension?
Yeah, no, I don't really want to go any farther than that.
You don't want to go back? Okay. Does it feel like it has to pop at all when you do that?
I don't know if I'd call it a pop. It's just like it's almost as if it's just everything jamming together.
Okay. All right. Arms at our side. And let's go ahead and flex to the right. Any issues? No?
No,
That's okay.
that's fine.
Flex to the left. No.
Nothing super bad.
Go ahead and rotate to the right. Any issues there? Rotate to the left. Good. Okay. All right. Now this one is gonna be kind of a little bit. We're just gonna kind of talk about it because I don't think it might be a little too hard to do. But what about your flexibility? What's your flexibility like in your hamstrings? I know you work with strength conditioning coach. Things in your hip flexors. What have they talked about?
They tell me it's not great, but it's not the worst that they've ever seen.
Okay.
We actually did measurements the other day, and I think they said that I was able to get about 70-ish degrees, pulling my legs straight up on both sides. About 15 to 20 degrees going straight back. Everything else, that was the only ones that they said might have been a little bit tight or limited. Other than that, everything seemed pretty good.
Okay. All right. Perfect. And then do you mind lifting up your shirt? Because I want to kind of look at your pelvis a little bit to see if we have any tilting in our pelvis. Okay. So in this position, what I want you to do is go ahead and try to pop that butt out a little bit. Good. Does that hurt your low back?
Yeah, a little bit. Yeah.
Okay. And then if you kind of bring your bottom down, contract your booty muscles, how does that feel? Does that feel better on the back?
Yeah, it's a little bit more of a relief. It almost kind of feels like just like the flattening in my back feels kind of weird, actually.
Yeah. Is that maybe because maybe you were always in this kind of rotated position where you're kind of actually arching?
So you mean more like that?
Yeah.
I don't ever feel like I am,
Okay.
but I guess maybe I just don't notice it.
Yeah, no, 100%. All right, go ahead and grab a seat, my friend. Okay. And then in the seated position, we're going to do a quick one, okay? And I know it's going to be kind of hard because you won't be able to see me. But
Okay.
here, I'm going to actually scoot back. So here, what I want you to do is go ahead and just flex your neck. Do you have any pain at
No.
all? Okay. And now here, I want you just to kind of lean on forward and slump your back. Any pain there?
I mean, a little bit with the slumping, just because,
That,
yeah, the slouching hurts a little bit, but that's it.
okay. And then still staying in that slump position, I want you to kind of lift your right leg. So almost like you're doing a knee extension machine.
Yeah.
And as you do that, is that increasing your pain at all?
No, I mean, it feels tight, but there's nothing
Okay.
that makes it worse.
All right, great. So remember we talked about kind of numbness and tingling. That was just something I kind of wanted to rule out. All right.
Oh,
Yeah. So sometimes you can get some numbness and tingling as you do that specific test, but you're obviously not demonstrating that. All right. So let's go ahead and anything else? What about your social system? I mean, obviously you're on a team, things like that. What about parents live close, relationship stuff, anything that as you're kind of, that actually might be a really good question. So I know this might be kind of a personal question, but if you are doing any intercourse, are you having a lot of pain in your back?
no, I'm not sexually active right now.
Okay. All right. And so, but given the family or kind of family dynamic, things like that, you obviously are part of the team. Anything else that I should kind of know about that maybe could help you? Do you have your dad's a chiropractor, anything like that? Have you done any chiropractor stuff? Have you done any acupuncture? Have you done anything like that?
So when I was still in high school, I did go to a chiropractor my senior year, kind of when
Okay.
it started. Um, I don't really remember too much about what he did. I do remember he said that he said that it looked like I was starting to have kind of like a flat back kind of thing where there wasn't as much curve. Um, and but he didn't really say it was anything to worry about at the time.
Okay. All right. So you kind of have done a little something, but not necessarily.
Yeah.
Okay, that makes sense. And then really quick, what we're going to do here, we're going to do what's called a kind of a patient-rated outcome, okay?
Okay.
So I'm going to go ahead and just kind of ask you the questions, and it's going to relate to your back. And then obviously what we'll do is we'll take this, and then after we've done maybe some rehab and things like that, we'll revisit this and see if there's a either lower or higher score. And I'll get through that, but that's not too important right now, okay? So we're going to look at pain intensity, okay? So I actually haven't spoke. Have you taken any medication for this at all?
Yeah. I mean, usually before either lifting or weights, I just take ibuprofen.
Okay.
Just over the pain.
So, so the couple questions is I can tolerate the pain I have without having to use pain medication, or the pain is bad, but I can manage without having to take medication. Pain medication provides me complete relief from the pain. Pain medication provides me with moderate relief, with little relief, or no effect at all.
I'd probably say moderate relief.
Okay, all right. And then lifting. I can lift heavy weights without increased pain. I can lift heavy weights, but it causes increased pain. Pain prevents me from lifting heavy weights off the floor, but I can manage it if the weights are positioned, so like on a table. I can lift only very light weights, or I can't lift at all.
Um, I can't really lift anything much off the floor.
Okay, so maybe if it's on a table, though, that you can lift some things off tables. So just
Yeah,
getting
that
an
helps a
example.
lot. Yeah.
Okay, all right. And then walking, do you have any pain walking?
I haven't recently, no.
Okay. So then I think we'll go ahead for that question. You can probably walk more than 1 mile until without pain.
Yeah, yeah, I'd probably say that.
Okay. What about standing? So if you stand for more than how many minutes do you have pain? Would it be 10 minutes, half an hour, 1 hour?
Um, it's usually about a half hour or an hour.
Okay, perfect.
Probably more like the hour.
Okay, perfect. And then you're talking about your social life. Okay, so kind of go away from football for a second. But
Okay.
your social life is normal, and does that this does not increase your pain. So having back pain doesn't affect your social life. Your social life is normal, but it increases your level of pain. So pain prevents me from participating in energetic activities, so sports, dancing. Pain prevents me from going out very often. Pain is restricting my social life to my home, and then I can hardly have any social life because of my pain.
Um, well, kind of like I said, like I don't truly really do all that much besides like lift and go to football. Just because I'm content with them as my friends. So, I'd say that no, it doesn't limit me at all in my social.
Okay. Um, employment and homemaking. So I know, are you currently employed? Probably not. You're employed as
No,
a
yeah,
student, right? Yeah, absolutely. So, but even go back to making your bed, things like that in the dorm or wherever you're living. So does that prevent you at all? So, I can perform most of my homemaking or job duties, but pain prevents me from performing more physically stressful activities like lifting or vacuuming. Um,
Um, so I did notice the other day, like I was going to get my laundry and I kept having to like reach over to grab stuff out, and that bothered me a lot.
okay.
So yeah,
Um, okay, that's good to know. So I will go ahead for that one. The laundry, I think I want to kind of I can perform most of my duties, but pain prevents me from doing more physically stressful, like lifting, vacuuming, laundry, things like that.
yeah.
Personal care, so washing or dressing yourself. What about putting on socks, things like that? Any of that bother you?
No, that's generally fine.
Okay. So you can pretty much do everything of your everyday life when it comes to personal care without any pain.
Yeah, I can pretty much do a lot of that stuff. It's just every once in a while I get pain here or there.
Okay, perfect. And then let's say sitting. So how long can you sit in a chair until you have pain?
Well, I mean, sitting right now has been kind of bothering me for a little bit. I'd say that's like half hour is usually how long I can go before I have to get up and try and move.
Okay, perfect. And then what about sleeping? Does it wake you up at all? Your back?
Um, I don't think it's ever, I can't remember any time that's ever woken up, but I have woken up and it been like really painful. Cause I mean, I tend to sleep on my stomach. Um, so, and I haven't really tried changing that or anything like that, but, sometimes I wake up and it's a lot of pain.
Okay. And then traveling. So when you guys are traveling with the team, what about I know it kind of goes back to sitting in a chair and sitting in an airplane and things like that. But what about carrying your bag, things like that? How does that, does it restrict you? Like you can only travel like maybe 2 hours. I mean, obviously in the football team, you probably have to travel more than that. But if you could kind of think about it like, yeah, after 2 hours, I'm tapped out or only an hour.
Um, I mean, I kind of just suck it up whenever we travel. Cause yeah, like you said, the sitting, it still bothers me after that half hour. So sometimes like, depending on what we're doing, if we're on a bus trip or a plane trip or something like that, I can try and like get up to walk around. But usually I have to do that by like the hour, 2 hours we be pushing it, but I have to do it by that time.
Okay. All right. Perfect. So I think I appreciate you filling that out, and then we will revisit that, and we'll see kind of after some rehab and things like that how it's going. Okay. Um, so a couple different things. I mean, obviously you've been a football player for a little bit of time. Kind of looking at. I know that you talk about your flexibility, so that's something that we definitely kind of want to work on, right? So if our flexibility can't move and our hamstrings can't move, remember the straight leg raise that you were talking
Yeah.
about? That's really going to play a lot with your hamstrings. That as you're going down to a deadlifting technique and you come up, if you kind of hyperextend, right, over time, you're going to kind of pinch some of those the discs and everything in between your low back. All right. So this is probably something that I would talk to your provider about. I probably want to just get an X-ray to look at exactly the spacing within your discs and things like that. Because we can kind of have what's called kind of a spondylolisthesis, and there's so many different type of names. There's different degrees. Okay, I think this is pretty still conservative. We kind of caught it early, hopefully, but we'll get this X-ray just to double check and make sure that there isn't any pinching in the nerves. But because you're not having that numbness and tingling, I'm feeling pretty confident that I think we can just, with increased flexibility, and then also working on some light extension. Okay, they're called McKenzie exercises,
Okay.
and working into that, because sometimes, especially as a student and things like that, we're kind of in a flex position. Okay, and then we kind of go into this like hyperextension, and usually it can come from tightness in our hip flexors, tightness in our hamstrings. So what I'm going to do right now, does that kind of make sense to you? There's no red flags that are really beeping out to me, but of course, like one thing I would tell you is that at any moment, if you start to get extreme numbness and tingling, you can't feel your leg, you have loss of bowel movements or urination issues, those are red flags that you immediately talk to your other athletic trainer on site or go straight to the emergency room. Okay, does that make sense?
Yeah. My only concern is, I mean, like, I mean, how can I get back to doing my stuff? Cause I mean, that's really what's most important to me right now.
Absolutely. And I completely, I totally understand, but I want to think about you right now. And then I also want to think, I know the game maybe is in the next week or something, but I want to think about you when you're going to have kids, when you're going to have grandkids. I want to make sure that you can lift down to the ground to pick up your child, or lift down to the ground to pick up your grandchild, things like that, right? And I'm glad that, even you took the initiative to come and talk to me, right? But right now, I think we need to wait at least until we get that X-ray. And once we get that X-ray, we might have a better plan of care, right? But for now, I would probably sit you out, because I don't want to keep mashing something, especially that disc, and then you have long-term effects that are going to affect you for the rest of your life. You know what I mean? And that's
Okay.
just me really wanting the best for you as a patient. You're my patient first before you're my football player. You
Yeah.
are a brother, you're a son, you're maybe going to be a father, you are all these other things. And sports are definitely, and you are also an athlete, but there's other things that, might be a little bit more relevant further on in life. And I think sometimes as clinicians, we just think about the next game, right?
Mhm.
And that could have long-term effects that I'm more comfortable kind of sitting you out until we get this x-ray and figuring out 100% what's going on. Does that make
Okay.
sense?
Yeah.
Okay.
Well, because my coach obviously wanted to know that as well, but um, my strength coach was wondering, like, I mean, depending on your recommendations, but he just wanted to know, like, if there was going to be different restrictions for football versus the weight room.
Yes. So I think for the weight room, I want you to do mostly body weight things. I don't want you doing any extra weighted movements right now.
Okay.
And then when it comes to football, I would probably do really no non-contact drills for right now, at least for the next week while we try to get this to calm down. We'll be working on your rehab. Hopefully you'll be in the athletic training room for the next hour during practice, and then you can do non-contact things.
Okay.
Okay. And I'm sure that's gotta be really hard to hear, right? You know what I mean? But,
Yeah.
and it's frustrating, and we will revisit this. This isn't like a permanent thing, but I think for right now, because it's increasing over time, then, we're going to go ahead, and I just want to treat it kind of conservatively. We'll get that x-ray, double check everything, and then we'll kind of revisit and go from there.
Okay.
Okay.
That sounds good.
Okay, perfect. So really quick, just for the next 30, 40 seconds, we're going to go over some quick exercises just because I know we're kind of running out of time, okay?
Okay.
So one of them is going to be kind of a hip flexor stretch. Have you ever done a hip flexor stretch before?
Yeah, a little bit of one, yeah.
Okay, so I'm going to go ahead and kind of move this. So one thing that I'm going to want you to do a little half kneel, okay?
Yeah.
And then here, a lot of the people kind of arch their back. What I want you to do is try to turn on your glute, okay? So pull your pelvis down and then lean forward. Just feel a nice stretch in here and come across. All right?
Okay. Yeah, I've done something like that before.
All right, perfect. And then hamstring, right? We got to work on those hamstrings. So here in a seated position, keeping your back flat. Don't try to touch your toes like this. Back flat. I want you to lean on forward, okay? Just feel a nice stretch in here. All right?
Okay.
And then the other one is going to be kind of, you don't like that extension right now. I still want to work on that extension, okay, but in a tolerated position, okay? So within this position, you're going to kind of be laying on the floor, and then you're just going to extend back, okay? And I would hold this, called Mackenzie, this evidence-based that this will work, okay? So as you're here, kind of coming on down, coming back up. All right? So I think for right now, we'll just kind of start with those three, and then we'll revisit in the next probably a couple days, and we'll kind of just double check with just working on some flexibility and those extension exercises, how you're doing. We probably won't do that patient-rated outcome again. We'll probably give it about a week or two until we do that. And then I can even reach out to your coach. If they have any questions or concerns, they can shoot me an email, and I'll send over the evaluation if you want consent for that, if you want me to let them know exactly what's going on with the thorough evaluation.
Yeah, I would prefer if you did, just in case I forget something.
Yeah, absolutely. So do you have any questions or concerns right at this moment right now?
No, I think I really appreciate everything because I think that answers some of my questions. And even though, like, yeah, it's gonna be frustrating that I'm not gonna be able to, keep going, but if you really think that it's best long term, then I'm okay with that.
Okay. All right. Yeah, I definitely think so. Just for right now, let's get that x-ray, and then we'll kind of leading from the x-ray, we can go from there.
Okay.
Okay. All right. Well, if you have any questions, you have my email. I will send over the documents to you, and then you can show them to your coach. Okay.
Okay.
All
Awesome.
right. Thank you.
Yeah. Thank you, Nicole.
All right. Bye.